miscommunication, medical errors that result into hospitalizations, and a lot of dissatisfied employees due to lack of communication, proper communication, timely communication across healthcare. Hucu solves this problem by organizing communication by location, by patient. Hey everybody, Asif Khan, co-founder, CEO of Hucu.ai. Short for two Latin words, Hucu.ai means care anywhere. The best way to explain Hucu is imagine Slack plus intelligence built for healthcare. That's us. Laura and I are co-founders. We got an amazing, experienced team. We both are serial entrepreneurs. I could say that because both of our companies exited, and Hucu is our second company we're launching together. The problem that we're solving is chaos in healthcare around communication. So as a healthcare professional, you get all these different mediums to communicate with others about patients, and it's all one-to-one. The bigger problem with that challenge is that miscommunication, medical errors that result into hospitalizations, and a lot of dissatisfied employees due to lack of communication, proper communication, timely communication across healthcare. Hucu solves this problem by organizing communication by location, by patient. So we have, just like Slack, we have patient-centered channels. And then as people communicate with each other, we use our algorithms to identify risk for the patient. And the more you communicate, the more you collaborate, the more you help, you get Hucu honors, which really sets you up and your cloud within the Hucu network. So this is what Hucu looks like. So this screen is showing you patient channels. Just like Slack, we have other channels, discussion channels, and direct messages. In a patient channel, you can bring different collaborators together from within your organization and outside of your organization. And each patient channel also has a family patient communication mode where you can communicate with the patients and families. And you can really bring anybody in the world in a HIPAA-compliant way into this specific channel to communicate with you. We have tremendous amount of analytics that show at a user level, at a patient level, and shows you what type of communication going on. We also have, this is my favorite, patient journey as an example that shows you where patient has been and where they're going and who's doing what. These are just some examples. We have tons of different reports and analytics. Market size is people which require a lot of handholding, so 2+ chronic illnesses. We are focusing primarily on senior market, people over 65, for which Medicare spend about close to $700 billion. Our goal is to reach 5 million in post-acute patients. We price on a per patient per month basis, and there are infinite user licenses, so you can collaborate with whoever you want. With that, our goal is to reach about 500,000 lives in about 4 years at 12 million ARR. Our customers who we serve are physician groups, nurse practitioner groups that are serving in the post-acute, and also community-based care organizations like area agencies in aging and community-based care. Our traction continues to grow. We are doing about 100,000 activities, messaging in a month. We are in over 500 locations and about 2,000 users logging in monthly. Total overall, we have 20,000 users. So we have done 1.2 million messages and 10 million times we have notified people. We are saving about 1 to 2 hours a day, which translates into 25x to 90x ROI, which is pretty significant. We are continue to grow. Our goal this year is to reach about 300,000 ARR. We are about 250 now, and hire some salespeople to grow it exponentially. Continue to have great partners, investors. We have a very strong competitive advantage considering we are the first patient-centered, and there's a free version of Hucu. Our ask is raising 2 million in a convertible note to help build sales, improve marketing and partnerships, and improve our product and identify new revenue streams. Thank you. Happy to answer any questions you have.
Awesome. It's amazing to see how you, Asif, what do you attribute your expansion, rapid market expansion to? You're in over 500 locations. How did you get there?
Yeah, so we believe that communication and care delivery should be done effortlessly, just like you text message and nobody charges you for a message. You can just send a message. So that's why we price on a per patient basis. So you can be caring for 20 or 100 patients, but you could be collaborating with 2,000 people. We don't care. So that, I think, is one of the key factors driving so much adoption in so many different organizations, because everybody likes to communicate in Hucu, and when they find out they can use the free version for their own care, for their own patient population, they start utilizing it.
Some good questions coming in too from attention. At what rate are patients renewing, and what is your customer acquisition cost?
Yeah, so it's a B2B product. So patients don't really renew. It's the business that subscribes to Hucu that continues to provide those services and coordinates care with the patient. So patients don't really renew. What was the other question?
Customer acquisition cost.
Yeah, so our customer acquisition cost roughly is about, I would say, through digital marketing leads and our own connection. I mean, it's about, I would say about $500 per customer, but our LTV to CAC is, we're increasing it. It's about 5 to 6 on average.
Great. And then are you able to integrate the single flow of communication into existing systems on the provider side, like EMRs and other systems like that?
Yeah, Hucu is actually a great question. Hucu is working just like here, like a plugin. So just like in Facebook, when you send a message, it opens up Messenger. Hucu is built the same way. So a lot of EHRs and other health technology companies with their core focus in health tech, you don't want to build a messaging platform, which is a totally different core competency. So instead, they're using Hucu to plug in the messaging component and leverage it for more stickiness and better experience for their customers.
So for the last question, paint the picture for us. Where do you see Hucu in about 10 years? What's your long-term vision?
Yeah, so I mean, I think if we're really thinking about, we're automating a lot of things that I didn't cover is robotic process automation, and I think this is a good slide to talk. People are getting Hucu honors as they collaborate more. So eventually, what we believe is in this network, you'll start to see best employees, at least in the short-term frontline workers that are out there that are collaborating, helping, providing better patient care. And robotic process automation is really getting to the right person at the right time without the person who needs that right person knowing who that is. So for example, in a skilled nursing facility in the middle of the night, a nurse doesn't need to know who to contact for a wound care or some kind of situation. She just presses a button in Hucu in that patient channel, and the right doctors get notified. They jump in, do whatever they need to do, and off they go to the next one. So where we see Hucu in the next 10 years is really automating this communication chaos that's happening in healthcare, not only from a hospital, but from hospital to skill to home and therapy, and everybody included. Everything is automated, and you have more visibility through data and analytics, like which people you're collaborating more effectively, which ones are not, which employees are worth keeping, which employees are just let go or transition out. We believe the days of the EHRs have been there in the fee-for-service, billing, progress notes, and all that. But when it comes to value-based care, which is the future, we believe Hucu is going to be the platform where care is delivered, because it's all automated, tremendous amounts of data, right people get notified at the right time, they jump in and they provide care in a timely manner. I think that's where we're headed.